Well, we'll go ahead and get started with introductions. Thank you for being here this afternoon. This is a reschedule from a prior event, so I'm really pleased to see many of you here. And we're really excited to be able to host our second in our series of virtual convenings for fellows for the 2022-2023 academic year. And again, thank you for coming. For those of you who don't know me, my name is Jeanette Tetro. I currently serve as the president of the American College of Academic Addiction Medicine, and I'm also a program director at Yale School of Medicine. Today, we're really excited to provide you with space to connect with one another after hearing a fantastic session led by one of my favorite people, ACAAM board member Lou Baxter, who has really been a stalwart in the field of addiction medicine, and it's just going to be a joy to be able to hear him talk about careers in the field of addiction medicine. Many of you are starting out, and I think you'll have a lot to hear about from Dr. Baxter. So I'm going to go ahead and introduce Dr. Baxter. I could spend probably a full hour on introductions, but I'll keep it brief. Dr. Baxter serves as the president and CEO of the Professional Assistance Program of New Jersey, which really cares for impaired healthcare professionals. He is also the medical director for the Division of Addiction Services in the state of New Jersey. The Department of Human Services in the state of New Jersey. He's an associate clinical professor of medicine at Rutgers University School of Medicine, formerly UMDNJ, and serves as the co-program director of Howard University's Medical Center's Addiction Medicine Fellowship. Today, Dr. Baxter's presentation is entitled Careers in Addiction Medicine, and honestly, there's no one better to give this talk. Lou, I'll pass it over to you now. Thank you so much for being here.
Thank you so much for giving me this opportunity. I think that this is an important presentation because when you come into the fellowship program, I think that some folks have an idea what they want to do and others don't. I would tell you to keep this in mind, and that is that when you are certified in addiction medicine, you can create your own job. You'll see what I mean a bit later. Next slide. So let's talk about some of the obvious careers in addiction medicine. You can practice as an independent solo or be involved with a group practice. There are physicians that are out there in their own offices. They have their own office staff, and they are providing addiction medicine to the public. Then there are physicians out there who are involved in group practices. Some of them are addiction medicine certified physicians, psychiatrists, and counselors. And there are also opportunities where addiction medicine trained physicians can practice in other primary care group practices. Next. You can practice as a medical director in an OTP, which is pretty much a methadone clinic. Those opportunities are available. There are some things there that you have to look out for, and we'll talk about that a bit later, but those opportunities are available. Certainly, you can serve as a program director or faculty member of addiction medicine and addiction psychiatry fellowship programs. Next. There are great opportunities in research. You can find it in industry, pharmaceutical companies. You can find it in universities and federal agencies. You'd be surprised how eager and how hungry the NIH is for addiction medicine physicians. There are quite a few that work for NIAAA, National Institute of Alcohol, Alcohol Abuse and Alcoholism, and for NIDA, National Institute on Drug Abuse. Next. You can serve as a hospital consultant and create an actual addiction medicine service. That has been done. I actually did it when I was at Geisinger Medical Center. Another physician and myself, Dr. Larry Greenfield, from inside of the internal medicine department, we created this addiction medicine service. And many of the things that are being discussed now, we did back in the 1990s, having a inpatient consult service, inpatient, well, it wasn't withdrawal management, it was detoxification service. And we did consults in the ER and in all of the other patient floors. So you could find a hospital that doesn't have any services, or one that does, and you could find yourself a way to fit in there, or create an addiction medicine service as a hospital consultant. Before I leave that, you can actually, if you can't get that far, if you just let the hospital, whether it's a small community hospital or a larger hospital that does not have an addiction medicine service, you can let them know of your availability to receive consultations. There are tremendous opportunities available in inpatient and outpatient treatment programs as the medical director. As you know, and if you don't know, you will know that ACAAM has 4 levels of care primarily: outpatient, IOP, residential, and hospital-based. And those facilities, those treatment levels, are always looking for some certified physician to be their medical directors. Multi-specialty groups, as I sort of hinted, there are primary care groups, OBGYN groups, even psychiatric groups that do not have an addiction medicine specialist within their group. So you have an opportunity to insert yourself as part of the multi-specialty team in those types of practices. Forensic litigation expert consultant. That sounds like a big job, and it really is. I would tell you that it's the sort of a job where you don't know what the case is going to be that you're hired to do, but it takes a lot of work. It involves reading patient records. It involves being able to examine laboratory test results. And most importantly, it's not for the faint of heart. When you have litigation, it is an antagonistic situation where you will have attorneys and even other medical experts challenge your findings and or your recommendations. But when you have a good addiction medicine fellowship training, you can more than likely stand up very well against some of the other so-called experts who do not have the same type of training. It's very profitable. You can do very well, but it's very time consuming. State health, mental health, and addiction services director. Every state has a health department or a human services department, and those departments have to deal with issues regarding writing regulations for that impact addiction, or interpreting rules, and also developing treatment protocols and things of that nature. So those jobs are available. They are often always looking for someone that is certified. You'd be surprised that in many states, some of the physicians that are currently serving as the directors do not have addiction services and do not have addiction certification. In many states, you can actually become part of those agencies as a consultant. And once that you get your foot in the door, if you so choose, you could move up to become the director. That has happened. I know it has happened in a number of states, and certainly in my state of New Jersey. Thanks. And there are other opportunities. Sports medicine, a consultant, you can offer your services to the high schools and to colleges and professional leagues. I have to tell you that there are a number of certified addiction physicians. There's not many, but there are a number of us that actually work for professional leagues. I've worked with the NFL as a consultant, and a couple of my other colleagues have worked with the NBA, as I have, and the U.S. Olympic anti-doping. I don't know of any of us that are in Major League Baseball, but I'm sure that they could use our help. And before we got started, I was asked to show my ring. And so I'm going to show you all my ring. Philadelphia Eagles, championship 2017. So don't tell me it can't happen. Next, please. Let's talk a little bit more about independent solo practices. You can be a freestanding solo addiction medicine practice. There are a number of them in my state where the physician primary specialty was OBGYN. She became certified in addiction medicine. So she has a freestanding solo practice where all the other OBGYNs in the area refer their patients who have issues with substance use disorder. She also has admission privileges into a number of hospitals, I think it's 3 hospitals, where she gets consults there when they have patients who are in for surgical issues, and they're, of course, pregnant. So having an independent solo practice can be very profitable, and more importantly, it can reach more patients. I don't need to tell you that a lot of OBGYNs are primary care physicians for women. Next. And it's very important that we are treating patients with FDA-approved medications for substance use disorders. When you're an independent practitioner, you will have people looking at you, especially if you are prescribing Subucade or buprenorphine, because the FDA approval is sort of your shield, your body of armor. The DEA looks at independent solo practices because unfortunately some of them are pill mills. And so when you're doing independent solo addiction practice, it's my advice to you that you only treat patients with FDA approved medications. Next. A referral source, once again, you can become a referral source to counseling services. There are a lot of freestanding counseling services from all levels, level 1, even to a level 4 at some hospitals, where you can make yourself available to have referrals come from the counselors to you, and that will be specifically to provide FDA-approved medications. You can find yourself providing medical director services to the treatment facilities. So this is not just being a referral source, but it's actually being employed by the treatment facilities. And these things you can do as an independent solo practitioner. Next. MRO services, medical review officer services. Now, even with your board certification in addiction medicine, I would advise you to get a certification as a medical review officer. The drug testing is perhaps our MRI for our specialty. Becoming certified in reading and interpreting all of the various drug testing modalities that we have becomes significant, and it will actually add something to your resume. MRO services are very important because sometimes a person's life, indeed their freedom, can turn on how you are interpreting test results. And if you interpret a false positive as a positive, someone may end up going to jail or lose custody of their children. And in my particular case, can lose their medical license to practice. So I would advise strongly that you do seek to become certified as a medical review officer. Insurance company consultant, and these are normally substance use disorder cases, but they can also be pain cases where insurance companies, I won't name one, but I have worked for a couple of insurance companies where they have sent clients to me who have had legitimate injuries, but they've been on pain medicine forever. And so the first thing that they want to determine is if the person has an addiction. And so it becomes important for us as addiction medicines physicians to know the difference between addiction and physiologic dependence, because certainly anyone that's on opiates for 5, 6, 10, 15 years are going to be physiologically dependent, but that does not necessarily mean that they are addicted. So insurance companies will oftentimes send these cases to us, and we determine whether they're addicted or if it's an issue of physiologic dependence. And then we recommend to them how they should proceed. These are short cases. There's no litigation involved. You get a chance to see a number of very interesting patients, and you'll be able to see that many times these patients are being cared for by pain specialists who have no idea about addiction, or they're being treated by their primary cares who also don't have any idea about what's going on. And so you can be the one to help not only straighten the case out and the diagnosis, but also offer a way to help that patient with their pain situation. One thing that you may hear during your training, but I want to be sure that you hear, is there's a condition that's called opioid-induced hyperalgesia. And it's basically the longer you're on medicines, your pain in some cases will actually increase. And the remedy is not to continue to increase the dose, but to actually reduce the dose. And I've had a number of those patients. So put that in the back of your cap somewhere. Next. Okay, being part of a multi-specialty group practice. Multi-specialty inpatient groups, as I described up at my former place, Geisinger Medical Center, and outpatient medical group practices. Groups will be made up in many fashions. A lot of them are internal medicine practices, internal medicine or family medicine, and OBGYN practices. You can develop partnerships and network referrals with psychiatrists and psychiatric hospitals and partial hospitalization programs. Although a lot of psychiatrists feel comfortable dealing with addiction issues, there are still quite a few pure psychiatric facilities who do not feel comfortable and would welcome the expertise from an addiction physician. You can serve as a section chief in internal medicine, as I described to you. You can do it also in family medicine or psychiatry departments. And in some of the progressive hospital settings, you can create that in OBGYN as well. Let's talk a little bit more about inpatient and outpatient treatment programs. A medical director or a medical staff physician is available. It can be part-time, full-time, almost any way that you wish to do it, you can. The facilities that are trying to maintain their CARF certification or maintain their new ACAAM certification in terms of being an expert facility, all need medical directors. In the state of New Jersey and in other states, all medical directors of all treatment facilities must be board certified. There are still some states where that's not a requirement, but that's becoming more and more available. Addiction medicine consultant to psychiatric hospitals, I've mentioned that. Once again, then you can serve for intensive outpatient programs, partial hospitalization programs, and private psychiatrists or groups. And you can serve solely, if you like, as a MAT provider for outpatient programs and as a resource for the treatment facilities. More and more treatment facilities are now allowing for patients to be treated with MAT while they're in treatment now. Unfortunately, that's only about 2/5 of all of the treatment facilities in the country, but it's getting better. And so when facilities, especially withdrawal management or detox facilities, are trying to compete with others, they know that they can no longer do the cold turkey or the other ways. They know that they have to use MAT now. So many of the facilities that were, as we have called them, dry, aren't dry any longer, and they're looking for an MAT provider. Hospital consultant, that's very interesting. You can do that in a number of ways. You can be a solo practitioner with hospital admission or consulting privileges. There are a number of physicians that do that currently. And it's a matter of getting on the hospital staff and letting individuals know that you are there, and you will get consults from nearly every department in the hospital. It's very interesting to get consults from the CIU when they have someone in there who's going through withdrawal. Or you get a consult from a surgical floor where they likewise have someone in there who was taking benzodiazepines and they had their surgery 4 days ago and now they're in withdrawal. So there are a lot of scenarios that occur and that present themselves when you're a hospital consultant. Next, please. You can be part of a hospital section or a department. I keep saying this over and over again because I really want you to get it from all angles, that all of these hospital departments are interested and they know that addiction is a hot topic now. And so they're all interested in doing better in terms of taking care of our patients. So you can become part of of a hospital section or even create one by doing addiction medicine consults. ER consultations for patients with substance use disorders. This is something that's wide open for small community hospitals. Oftentimes, when people come into the ER, more than 60% of them have some sort of a substance issue going on. Either they're in a motor vehicle accident, they cut their finger off with the saw because they were drunk, or overdoses. And a lot of these smaller hospitals do not have inpatient facilities to make direct referrals. But if you are known to those hospitals, they can make those referrals to you. Next. Hospital referral source for patients with SUDs. And once again, even if you're not part of the hospital or have privileges there, if they know about you, they will refer their patients. And that's a nice thing to have going on, actually. Research, we touched on that. Colleges and universities, teaching and research faculty, all of those things are available. Publications, if you look at some of the publications that are out there now, a lot of them are by PhD types with maybe an MD or a DO. But I think that the field is hungrier to hear more in an academic sense from addiction medicine practitioners. NIH, NIDA, NIAAA, they are also very interested and are offering research opportunities for addiction medicine fellows. I have an advantage of being in Washington, D.C., but I'll just tell you that they have opportunities for fellows to do research while you're in your program. And of course, they're very interested in hiring you on if you are so inclined. Next, please. Pharma. I've done work with pharmaceutical companies, and not the bad ones, only the ones that are developing medications for our patients. And the jobs are all over in pharma. There are jobs in research and drug development. There are opportunities to do investigations of some of the medications for substance use disorders. And you can also find yourself as one of the participants in the FDA approval process. And that's very exciting. You can work with the regulatory agency, the FDA. I have done that. That's an interesting thing to see. Primarily, you would be bringing your addiction medicine expertise to see if new medications, and I'm talking about the bad ones now, have a significant abuse potential. That's an exciting opportunity, and it exists for us that are certified in addictions. Addiction medicine fellowship programs, certification, you need to have certification in addiction medicine or addiction psychiatry to qualify for these programs. You need to get an academic appointment in almost every case, I believe. Have to establish hospital privileges. ACGME accreditation for the programs. I'm not sure, but I don't think that there are any addiction medicine fellowship programs that are not ACGME accredited. There may be some, I don't know about it. The addiction medicine fellowship programs are usually in a specialty home, either under internal medicine, family practice, or psychiatry. I think that there may be one or two under emergency medicine as well. And it's very important to have a dedicated faculty and staff with program administrators. You have to have some physician supervisor, and of course, to have some outside rotation facilities. And the program director is responsible for everything. So if you like that position, just be ready to be responsible for everything. OTP, methadone medical director. Okay. Now they have to review, they are supposed to review all cases for admission and management. Now you can imagine that if you have a methadone a program that has 700 or even 1,000 participants, that's a really big job. Now, unfortunately, most of the medical directors don't actually see all of the patients all the time. And here's where it becomes a little dicey. Some of the medical directors have nurse practitioners and others that they rely on and that are trustworthy, who will actually do the admission examination and admission paperwork. But it's the medical director that's responsible for it. It's your job as the medical director to determine the maintenance dosages. And I'll tell you that there's some issues there because NIDA says that any dose less than 60 milligrams of methadone for maintenance is ineffective. And there are some facilities that will try to maintain people on lower dosages of methadone because it's a cost issue. And those patients sometimes, well, not sometimes, many times will actually continue using illicits because they don't have a high enough dose. You need to determine the need for changes in dosages. People may have other factors that will require them to use higher dosages of methadone. They may be on certain other medications. And so you'll need to know what other medications affect the metabolism of methadone. But it's the medical director's job to make those determinations. You're responsible for compliance with all federal regulations, state regulations, or any community regulations that may be applicable. You're responsible for all medical, psychiatric, and nursing care. Okay, go back, please. So my point is that methadone is a great medication. OTPs are perfect for a number of patients. However, because there are a lot of federal regulations involved, also a lot of these facilities are owned by non-medical people, and to some people, it's an industry. And so if you're going to get involved as a medical director in this situation, I just want you to be aware that you have some areas where you have to be vigilant, and you just need to know that it's not always as easy as what it appears. When you're getting interviewed, they tell you that we have this taken care of, we have this taken care of, and we need you to just sign off. Sometimes it can be a lot more involved. Okay, next, please. Forensic consulting experts, and this is litigation expert for legal cases. There are cases where I've been involved with where a health insurance plan was trying to claw back money they had paid for over 5 years to a treatment facility. And it was because of lack of clear diagnosing. They didn't match up the DSM criteria with the diagnosis, or they didn't use the right codes. I've had other situations, of course, where there's malpractice. There are cases where you could be called on to talk about liability. Sometimes patients die in treatment. There's a lot of twists and turns that find their way to the judicial system that involve addiction, and you may be called to help with those cases. Thanks. Having an active clinical practice also bodes well for you. It seems that juries and even judges don't really like bookworms only. They like people that are actually involved in a clinical practice, and it should be a practice that reflects on the case at hand. Experience with substance use treatment is also an angle that they specifically look for. Someone that has worked in a detox or a withdrawal management. They want to have an expert who understands admission criteria, ACAAM criteria, discharge standards, methadone maintenance, federal regs and state regs, and also MAT issues. They always seem to want to hear a review of standards of care in issues. As you all know, in medicine, there's more than one way to treat a condition. And some people will flock to one group and some will flock to another. And it doesn't mean that one is wrong or the other is right, but they're looking for people that are out deviating the standards of care. So it becomes a job of you sort of being the middleman and the decider of what's bizarre and what's standard. Expert medical opinions are sought on treatment, on whether the patient was managed appropriately. Was there compliance with the operating standards and protocols? And so it's good to know national guidelines. State agency mental health and addiction services. Medical director of a State Department of Mental Health or Addiction Services. I've had that job. It's very gratifying. You get a chance to take what you've learned and help develop rules and regulations for the state, such as the medical marijuana that was first starting a few years ago. We had the opportunity to weigh in as an expert on rules and regulations. And then when medical marijuana was approved, then we got involved with the rulemaking for the Department of Health. So it's very exciting work. Consulting medical director to some state agencies, the Department of Health, Department of Human Services, Senior Services, Medicare, Medicaid, which will allow you to weigh in on what medications that the state is going to pay for, what medications they're going to stay away from. So that's also been an exciting opportunity. director of state departments of health. Believe it or not, many directors of State Department of Health are not physicians. It's pretty much a political appointment, of course, but there are opportunities to serve as deputy director, and you can then impart some actual clinical experience and knowledge there. Addiction medicine expert for the state assembly or the Senate. I've been fortunate to be able to testify to our state assembly and our Senate, also having been involved on the national levels. We've done it with the U.S. Congress and Senate as well. But these are some of the opportunities that you have as an addiction medicine expert. Next. State's expert in negotiations with insurance companies. Once again, what the insurance people will want to pay for and what they don't want to pay for, their protocols of fail first. I don't know if any of you are old enough to remember that, but in addiction treatment, they made you go to a lesser level of care and fail. So that is either relapse or overdose, and then they'll let you go to a higher level of care. Well, we don't have that anymore because of the advocacy work that addiction medicine specialists were able to do with insurance companies. And there are many other opportunities. As I told you at the beginning, you can create your own. You can volunteer to help at the high school level. Even if you are advertising, I hate to say that, but even if you are advertising your services, because there are kids in high school who have drug and alcohol problems. There are athletes in high school who also have problems with pain meds. Likewise to colleges, you can be an addiction treatment advocate and also become a referral source for them. Next. High school sports and college performance enhancement and impairment issues. These are opportunities available. They won't come looking for you, but you can go and let them know that you're there. Professional sports, drug and alcohol, advisory councils, and many, many more. So I'm running up on my time, but we have time to do some questions and answers. I think that's the end. Is there more? Okay, that's it. Thank you.
All right, if you have a question for Dr. Baxter, please feel free to unmute and ask a question, and then we'll have him answer.
Dr. Baxter. Oh, sorry. Go ahead.
Dr. Baxter, I have a question for you. Joining you from California, where it's rainy today.
Oh, sorry about that.
Oh no, I'm delighted. So I am interested in working as a medical director at a private residential rehab center as one of the things I'm interested in after this fellowship program. I have almost 20 years of experience as a primary care physician. I'm a family doc, in addition to being a fellow. When I have actually looked at job sites and looked at the websites for these different treatment facilities that I think I would, be well qualified to work for, they usually say that they're looking for psychiatrists, and they usually don't mention people like myself with addiction medicine certification. They just all say psychiatrist. And so I'm wondering if you have any comment on whether I should just be applying for those jobs, whether they really need a psychiatrist. Just curious about your thoughts about that, because I would hope that I would be considered well qualified, even though that's not what it's saying online.
Yes, and you're absolutely right. And that's because that the addiction medicine fellowships are new. This is over the last 5 years or so. And the other thing is that a lot of these facilities have always used psychiatrists because that's who they thought could handle addiction better. And they like to have psychiatrists who have addiction experience. And that's different from expertise, because there are many psychiatrists who do some harmful things. I'll just be honest. I'm a straight talking guy, so I'll have to put it that way. But I think that if you really want the job, that you could spend a few minutes educating them and telling them that that many of the psychiatrists don't have training in addiction, and that you have been trained in a fellowship program, ACGME approved, and all of that sort of stuff, and let them know that as an addiction medicine physician, that you can cut down on their AMA rates because you can provide adequate withdrawal management or detoxification, and that you are capable of dealing with minor psychiatric diagnoses. Some of them like that, especially when you always talk about what's most interesting to them, and that's their bottom line. So if you tell them that you can give them better treatment and better protocols, and that they will lose less money, they'll listen.
Thank you so much.
Hi, Dr. Baxter. Thank you for a great presentation. It's very useful. I'm an addiction medicine fellow right now. I'm actually starting to look at jobs now, so this is kind of good timing for me. I'm actually, thank you, Dr. Glynn. Hopefully I pronounced that right. I'm actually in this similar situation. I just finished family medicine and I'm doing the fellowship in addiction medicine. So that was actually one of my questions. Thank you for asking. But my other question is, for a lot, there's so much variety in a lot of these job opportunities. I'm looking specifically for like faculty or even the state agencies or NIH jobs. Is it best to just do cold calling looking for these jobs, or is LinkedIn like a good place to look for them, or like are there good places to look, or like where exactly should I be looking?
Yeah, LinkedIn is always good because they always got something up there. Doximity is another place, but I think that if you have an idea that you want to do some academic medicine and clinical medicine, that you should find the locale where you want to be, and then approach those facilities. Because like I said at the beginning, no one will come looking for you. You have to go out yourself. Now, you may have some opportunities. ACAAM does not have an employment board or anything like that, but certainly ACAAM can assist you. ACAAM has an employment website. So there are some things that are advertised, but primarily you're going to have to figure out what you want and then go to it, or figure out what you want and create it.
Thank you so much.
Any other questions for Dr. Baxter before he has to head out to his next meeting, and before we begin our opportunities for networking with one another? All right, I'll take the silence as a no. Dr. Baxter, anything last second here from you?
Yeah. The last thing that I want to tell you is that we still have to educate people that they need addiction medicine specialists in order to take care of their patients. None of the medical specialties, none of the institutions, hospitals, or anything deny that substance use is a big problem. And that's because of the overdose steps and all that sort of stuff. But what has to happen, I think, at this point, at this juncture, is that we have to let them know that we're here and how we can assist. And you'll find that the doors are a lot more open than what you expect.
Dr. Baxter, thanks a lot. Good to see you, and really appreciate the expertise and wisdom today. Thanks so much.
Okay, thank you for having me.
All right,
Bye
have a good
now.
one. So everyone, thanks for being here again for today. I'm Bruce Hammond. I serve as ACAAM's Executive Director. I did want to, Don did put it in the chat, but I wanted to just make note of the fact that ACAAM actually does have a career page on our website. So we would encourage you to take a look there. There's a job board there, as well as some other things related to career development. So make sure you head to acaam.org and you can learn a little bit more about the positions that are highlighted there and those kinds of things. I also did want to take a couple of moments before we jump into a couple of small groups just to give you a couple of notes. First, as you see on the screen here, we encourage you to save the date for our ACAAM annual meeting, which is taking place April 11th and 12th in the DC area. There's a couple of opportunities that I wanted to make sure that you're aware of, specifically as fellows in your training. There is an abstract call for abstracts that's currently open right now for the ACAAM meeting. We both have fellow lightning round abstract call open, which is essentially a 5-minute, 5-slide presentation on a topic of your choice. These are something that we started back in our 2021 annual meeting, and it was really, really well received by the attendees of that meeting. So certainly encourage you to take a look at that call for abstracts and participate in that opportunity. We also have a larger call for abstracts, the deadline for that is January 3rd. So you have a little bit of time still to participate, a couple of months still to be able to get your abstracts in for the lightning round piece. We also have our call for workshops call for abstracts for workshops open as well. And these 5 bullets here on the screen are where we're kind of trying to focus those abstracts. And so again, encourage you to head to our website, learn a little bit more about what these mean, and maybe consider, partnering with a faculty member at your institution or your program director to kind of put in an abstract in one of these areas. We're really trying to focus the annual meeting this year a lot on a kind of a train the trainer kind of model. And so we want to make sure that there are opportunities for folks to learn about kind of the unique ways in which education is being provided, opportunities for career development abstracts and how people are doing their career development. And so the deadlines for that call for workshops is December 1st. And so that's only a month away. So if you're interested in doing that and being a part of the meeting, be sure to, again, connect with a faculty member or submit something on your own, and we'll take a look at it and see if we can incorporate it into the meeting. I also wanted to just take a quick second to let you know, if you haven't already seen this, you may have already seen it because I think we sent a reminder about it yesterday, but that we are going to be at the Immersa conference next week in Boston. So if you're going to be there, we'd certainly love to see you for our networking session. That event is on Friday night, November 11th from 6 to 7 Eastern time at the Boston Hyatt Regency. There's information on our website and actually on our Twitter feed about that. And we also, again, like I mentioned, just sent a note about that yesterday. So if you haven't seen that, make sure to take a look at your emails. And that provides the actual room location and that kind of stuff of the meeting. I think what's on this slide is a little outdated. So we'll make sure to update that. But take a look at the email we sent yesterday, and that provides you with the information. So with that being the case, and with that being kind of completed, those few announcements, we're now kind of on to the main part of what we're trying to do today, and that's an opportunity, giving you an opportunity to connect with one another a bit. We found that lots of times you all trainees are looking to connect with other trainees across the country and learn a little bit more about one another, and maybe build your network for when you finish up. Maybe you're looking for a job in California and someone's on here from California who might know some great opportunities out there. And so building that network is important. So I think what we're going to do, let's see how many we've got. 1, 2, 3, 4. So I think we're going to break into 2 small groups, have you guys connect for a bit, and then we'll pull you back together quickly. And then we'll see about breaking you out one more time with a different group of folks. I am going to post in the chat some information that we're looking for you to kind of, a little prompts essentially for you to kind of utilize as you get into your groups. And I'll put that in right now. So we're looking for you to kind of share your background a little bit, who you are, where you came from your residency in medical school, as well as where you are in your fellowship. Maybe what you took away from today's session and thoughts on what you might do after completing your fellowship. And then maybe what you've been working on. So what kind of rotations have you been doing? What kind of research have you been doing? Connecting with one another around that as well. And you might find that you're doing a lot of the same things as other folks, and you might find that you're doing things a little differently than some other folks. And we'd love for you to have the opportunity to connect and engage around those topics. So we'll bring you back together in the next 10 to 15 minutes or so after you've had the opportunity to go around and kind of connect and chat with the groups, the folks in your group. And then we'll maybe break you out one more time and allow you to head out a little bit early today. So again, Dawn, if you wouldn't mind dropping us into our rooms. I'll just say one before we do that. Any questions, any thoughts that came up from the few announcements we just made before this? All right, doesn't sound like it. So let's drop you into your rooms and enjoy connecting with one another. All right, thanks a lot.